CEO of the Squirrel Hill Health Center, chair of the URJ's Commission on Social Action. How are you this afternoon?
I'm very well, thank you, Rabbi, and delighted to be here talking with you.
You were sharing a little bit before we started that we're in your home right now.
Oh, yes, you are. I have barely left my home since March 13th, uh, but it doesn't stop me from working all the time. In fact, unfortunately, I think the problem with work from home is it becomes all consuming sometimes. But
Who would have ever guessed that closing buildings meant that we were all working far harder than before, right?
I know, I know. And I think it's probably changed work life forever for many people too, but we'll see.
And as you say, it is just getting increasingly busy. What have you been up to first professionally, if you would?
So I'm the CEO of Squirrel Hill Health Center, which is a nonprofit, what's called a federally qualified health center, a community health center. We were created by Pittsburgh's Jewish community. We opened in 2006, and we provide affordable, accessible, high quality primary and preventive medical, behavioral health, and dental care to anyone who needs it, regardless of insurance status or ability to pay. And in part because of our Jewish roots, although we're not a faith-based organization, we're not part of the Jewish agencies, we're completely independent. But in part because of that, we have a special focus on refugees and immigrants. So about 60% of our patients are either refugees or immigrants. So we have been extremely busy. Obviously, this is a public health crisis with a particular impact on vulnerable populations. We're seeing how that plays out all over the country. That the highest risk groups are often low income people who live in crowded housing conditions, work in service jobs, and often people of color are particularly vulnerable. So we've been very concerned about our patients, and we've also really had to reinvent ourselves. Up until March 15th, we had never done a telehealth visit. We did everything in person. We have two sites, one in Squirrel Hill and one in Brentwood. And then we have a mobile medical unit that we take out to all over Allegheny County, including a number of South Hills locations. So every single visit we'd ever done was face to face, and now suddenly we couldn't do that. So over the course of a weekend, our chief medical officer and I and our executive team basically put our heads together and figured out a plan for that first Monday after the shutdown, and we shifted everything we could to telehealth. So we now use Zoom for most of our meetings, try to do video conferencing, but we have a lot of patients who can't do video conferencing, so we reach them by telephone. And we're doing almost all of our behavioral health care that way. Dental services were shut down completely by the governor for quite a while, with the exception of a few emergency services. We've even done dental care by telehealth, if you can imagine that, having somebody put their smartphone in their mouth so the dentist can see what's going on. And and we've done as many of our medical services that way as possible, even including prenatal care, not all of it, but some of it, and a lot of our services for older adults. So we do still see some patients in person. We have to see some of our prenatal visits have to be face to face to be safe. We see newborns. We're doing pediatric immunizations. We're very worried about children getting derailed from that and the impact that could have down the road. But that those in-person visits are now only about 10% of our visits. So we've reinvented this whole way of practicing, and we've also been struggling with the same issues that you've heard about in the news: lack of protective equipment, lack of testing. We finally got our first tests last week, and now we're out doing a lot of testing. So if anybody's listening, the county is now working with all of the local community health centers to provide free testing at the moment. And the sites are listed in the county website, or you can get in touch with us. We're going out to the places we take our mobile unit, and we're doing it outdoors. It's very safe. It's a swab that the patient administers themselves in their mouth. And we're finding that there's still infection in our community. So despite the shift to yellow, and I think the eagerness we all have to get outside, which is a good thing, and to start feeling more normal again, the world isn't normal. So it's so important that we all go outside safely and see people safely. Wear masks, keep a safe distance, 6 to 10 feet from the people you're with. Wash your hands, wash your hands, wash your hands. And that's how we can keep getting through this. But it's been real. It's been a really extraordinary experience for all of us.
Right. And to be doing all of that from your kitchen table, I can't even imagine what it is to completely transform an organization that is really on the front lines of this crisis.
Well, I'm
you and your team.
Thank you. I'm the lucky one. You know, I would only be in the way if I were out in our offices where we're seeing patients, or out in the field doing the testing, because I'm not a clinical person. I am in awe of all the people in healthcare and our first responders and people who are working in stores and keeping us fed, because they're the ones who are putting themselves at risk every day. And it was agonizing at first for me to be home making decisions about who had to be in the office. I think we've gotten into a rhythm that feels safer. We do now have enough protective equipment. We would never do anything that jeopardize the health and safety of our staff or our patients. So what we're doing now, we're doing very carefully, but we're going to have to start seeing patients. There's a lot of pent-up need, and again, we're only going to do it safely. It's been an extraordinary experience, and our staff has been meeting. At first, we were meeting everyone on the staff twice a day. Now we meet 4 times a week, and just regrouping, and we try to get somebody to share something that's getting them through this moment, whether it's a new puppy or a story about something that they're doing that helps them take care of themselves. And in some ways, even though we're remote, I think we've become closer as a group. We've also had the financial challenges that every business has, and those at first were completely overwhelming. So how do we make payroll when we have no revenue? So we've kind of lived this from multiple sides of the experience. And frankly, we're really, really worried, not only about what happens now, because we're concerned about a resurgence as people let their guard down, but we're really worried about what's going to happen as we come through this, because so many people have lost their health insurance, as they've lost their jobs. And that's, those are the populations community health centers take care of, and they've neglected other health needs. So we need to be there. We need to stay strong, and we need to be there for our patients and our community.
It's an important acknowledgement that this is in some ways only the beginning of the work. As frantic and frenetic as this period has seemed, it's going to be quite a slog. We're lucky to have you steering that ship.
Thank you. It's a privilege to do this work. I'm lucky.
There's the old aphorism that when you need something done, you should ask a busy person. And I'd be fascinated to know if you have a patent on that machine that allows you more hours in the day than the rest of us get. But in addition to working with the Squirrel Hill Health Center, you're also professionally volunteering, that you are running the URJ CCAR Commission on Social Action and leading them through this same exact and challenging time. Can you say a little bit more about what's going on there?
Yeah, I'd love to. Well, again, the absolute blessing of that work as well is working with amazing people, absolutely top-notch staff, incredible staff, as well as great volunteers. And this is a really difficult time for the URJ. I think your congregants are aware of that. You know, anybody who belongs to a synagogue, I think, is aware of it. Um, the challenges that so many of us are facing in our own professional lives are writ large in an organization the size of the URJ. And the most painful decision that was made and was pulling the plug on our summer camp program. It's kind of the one of the foundation blocks of our whole movement, in addition to our 900 synagogues, our incredible camps and the experience we provide every summer to children and teens and to young adults who staff the camps. And it just couldn't be done safely this summer, and it was very hard. And I think all of your congregants who send their children to camp or have sent their children to camp in the past understand the loss that is to the community. It also has a financial impact on the movement. So it's a hard time at the URJ. And all that being said, we are so excited because we have just launched our civic engagement campaign. And it is the URJ's big project is specifically lives at the Religious Action Center, which the Commission on Social Action oversees. So I am thrilled that we have this campaign. We launched it on Zoom. We thought we'd get people to join a Zoom meeting to announce this campaign. It turned out 1,400 people signed up, and Zoom only accommodates 1,000 people. And so we had the Zoom launch and simultaneously streamed it live on Facebook. And it was just really thrilling to be part of that, to watch all these people joining and engaging. And now the work begins, because now what we really, really want to do is capture that energy and, frankly, some of the angst of the moment and help people direct it in a productive way for making sure that every single eligible voter in this country has the opportunity to exercise their constitutional right. It is a privilege, and it is also an obligation incumbent on all of us who have the privilege of voting to vote. And so we are really focused on this now. And this is not a partisan issue. This is about democracy at work. And democracy doesn't function if people don't have access to the ballot box. So as we know, here in Pennsylvania, we had to move our primary, and now we have vote by mail because it really isn't safe to crowd into a church basement or a synagogue or a school and stand in line to vote. The safest way to do this now is to do it from home. And we want to make sure that around the country, our fellow citizens have that opportunity as well. It is an issue that is federal, but it really plays out at a state and local level. So there's an opportunity to be involved wherever you are, and great opportunities to do this work safely from home. So I'm proud and excited to be part of that.
It's a really important thing. And as you mentioned, it is one of the ways that Jews across the country, Americans across the country, synagogues can get involved in a very important civic issue in a very nonpartisan way. This is about access to democracy and ensuring that every eligible voter has their vote counted. Would you say a little bit more, what is bubbling up? How can people get involved? And what are some of the things that we as congregations might do to assist in this effort?
I'm so glad you asked. Well, the first thing that both as a congregation and as individuals people can do is we're going to have some trainings. If you go to the Religious Action website, rac.org, I'm going to look at my other computer screen. It's Civic Engagement Campaign 2020. You'll find that in June we have several webinar trainings scheduled so that people can learn how they can get engaged and can help train others. So it is going to be about combating voter suppression, about mobilizing voters. We have special trainings for students. We really hope to engage our teens. This is something that has a huge impact on young adults, and even teens who aren't yet old enough to register to vote themselves can work with their older friends and family members to make sure that everyone they know is registered. This is about 100% participation across our movement. Every eligible voter in our movement, we want to have registered and voting in November. And it is also about what we can do to make sure that people outside of our movement have that same opportunity. So the first training is June 3rd, and then there's another one on June 11th. They're in the evening, they're online. It's easy to participate. And we're using that as the building blocks. And then we're going to continue to have tools and support for our congregations to be working on this effort. In Pennsylvania, we're also trying to work to mobilize a statewide effort, which we've not done in the past. So there are statewide organizations of the Religious Action Center in a number of states: California, Ohio, Florida, New Jersey, New York. And we are in the early stages of organizing here in Pennsylvania, so stay tuned for that. I'm hoping that there will be some very specific opportunities for all of us who live in Pennsylvania as well. And it's not because I live in Pennsylvania that this is happening. This is happening despite me.
That's right. So, we live in a really important state, not only for our democracy, but for the Jewish community. I'm excited, and thank you for that link. I've posted it in the chat so that anyone is able to click on it. I'm also excited that Temple Emmanuel's Board of Trustees has approved, ratified, agreed to our involvement in the effort, and I look forward to engaging everyone in the congregation to get behind this.
I'm delighted to hear that.
Yeah, me too.
Really about that. Yeah.
So, what else do you have your eye on as chair of the CSA when, after the November elections are over, whether the world has settled down or not, the work doesn't stop? What other things are you working on?
Yeah, so we have ongoing efforts around immigration justice, women's reproductive rights, racial justice, environmental justice, we call it. None of those issues go away. And we are going to be picking up those threads makes it sound like we're dropping those threads. We're not dropping them. What we are asking is that in terms of what we can do to support our members across the country, we're going to put all of our staffing efforts into the civic engagement campaign, because we believe that encompasses everything else. That it's not really you're not really going to get very far working on immigration issues if you haven't participated in the election. And after the election is over, we will know a lot more about where we stand. And frankly, by late fall, early winter, we're going to have a better understanding of where we are with COVID-19. It will not be gone by then. I'm not one of the people who believes that there's a vaccine, a month away, but we will have a better understanding of how it is playing out in this country as well as in our own backyard, and that will allow us to figure out how we engage in our work going forward. So there isn't a master plan at the moment for what happens after that, but if you care about the environment, if you care about racial justice, don't stop caring about those things. Don't stop being engaged in those issues, but do bring that passion to civic engagement. And one of the things we're advocating is that at a local level, we all work across differences with other organizations that are also engaging around around voter rights and civic engagement. So that is a way to work with groups that work with immigrants or with Black groups or groups serving working in the Black community around voter engagement. There are lots of Christian groups. There's a lot of opportunity here to collaborate and keep deepening those relationships that will make us all healthier, better people and communities on the other side. Health is about taking care of our bodies and keeping viruses away from us. It's also about looking out for each other, keeping our focus on not only our own needs. It's so tempting to be really self-engaged and absorbed in this moment because we've battened down the hatches, we've closed our doors, we've closed our walls around ourselves. I would argue that it's an even greater opportunity, especially those of us who are fortunate enough to be like, how can I complain? I get to sit in my lovely home. I have food in the refrigerator. I have a job. I have nothing to complain about. I can't stop caring about those who have less. In fact, it's an opportunity, especially for people who have more time on their hands, to be even more deeply engaged. It is our obligation as Jews to do that.
I couldn't agree with you more, and I'm so delighted for your time. I also realize that there are many in this world who need you right now. So let that be our last question. Susan Kalson, CEO of Squirrel Hill Health Center, chair of the URJ's Commission on Social Action, thank you for the many myriad of things you do to make this world a better place.
Thank you so much. Thank you, Rabbi, and thank you for the opportunity to chat with you. It gave me energy. It really helps me keep doing this, to have these kinds of conversations. So I appreciate it.
Thank you.
So